Welcome to the 2015-2016 Open Enrollment for Target Engineering Group. In this presentation, we are going to explain all you need to know about your benefits. First of all, benefits start October 1st, 2015. And Target Engineering Group offers you a comprehensive plan from medical all the way down to short-term disability and accident insurance to meet your family needs. If you're working full-time, that means you're 30 hours or more per week, you're eligible to enroll in the benefits described in this presentation. New hires must wait until the first month of the following 30 days of active employment for benefits to be eligible. All right, so how do you make changes? The open enrollment period is between September 21st and 25th for an effective date of October 1st. Now, once you lock in to the new plan year, you cannot make a change unless you have a qualifying event. Marriage, divorce, birth, legal separation, domestic partnership, you see the list there. So just make sure you understand how the qualifying event works. Here's the medical and prescription drugs benefits summary. As you can tell, there's an extra plan. And within this specific slide, I'm actually going to go over the differences between each plan. That way you understand the mother of all benefits, your medical. So you've got the premium plan. The physician visits and specialist visits, they're going to have copays across the board. The premium, standard, enhanced plan, the new plan, they all have copays. And remember, a copay basically is what you pay at time of service. So for physician visits, premium plan is going to be $25, the standard plan is going to be $30, and the enhanced plan is going to be $25 respectively. That's like going to your primary care. Now, if it's a specialist, that's anybody that ends with an IST. It is going to be someone like a cardiologist as an example. You can see that the copay is going to be higher, but all copays are going to be within $5, if you will, of each other. Now, your deductible. The deductible is always the money that you're going to pay out of your pocket before the actual insurance start for your big ticket items, i.e. like hospitalization, outpatient surgery, and anesthesia, so on and so forth. The premium plan, why it's labeled that, is because it has a lower deductible, lower than the standard plan, lower than the enhanced plan. And the individual deductible is a $500 individual deductible with a family deductible of being $1,500. Now, once you go to the standard plan, it's going to be $1,500 up to $4,500, and then $2,000 up to $6,000 in the enhanced plan. Basically, what that is saying is that each individual on the plan has a $500 deductible up to the maximum family plan deductible, if you will. So if you had, example being on the enhanced plan, let's just say it's yourself, your spouse, and you have 2 children. Each person would be responsible just for their $2,000. Now, once you hit the $2,000, coinsurance does come in and pay, which is the insurance portion, and then you're going to have a maximum amount of pocket. So once you hit the $6,000 total, then you're good to go on the family deductible. Now, if you'll kind of go down a little bit, hospitalization on all 3 plans are covered after the deductible, and then it goes into the coinsurance method. Preventative care is going to be covered at 100% on all 3 plans, the premium, the standard, and the enhanced plan. That's like you're going to get your annual physical for the ladies at your well woman exam. If you go in and they code it as a diagnostic procedure, it will go towards your deductible. The advanced imaging, the only plan that is actually has a copay is the standard plan, and that's $250 in a copay, and that again is a richer benefit. But the premium and the enhanced plan are going to be the deductible plus coinsurance. If you go to the ER, your premium plan is going to be $300, standard plan is going to be $250 in a copay, and $150 in an enhanced plan copay. Now here's your out-of-pocket maximum. So the out-of-pocket maximum is the max threshold you'll pay in a given year. So the premium plan is going to give you a $3,000 out-of-pocket maximum for individual, $6,000 for family. The standard plan is $4,500 for individual, $9,000 for family, and then $2,000 for individual and $6,000 for family on the enhanced plan respectively. So if you had a catastrophic claim and you're on the enhanced plan, you're going to actually, let's just say if it's a $100,000 claim, be responsible for $6,000. Your prescription drug coverage is the same across the board. It is a $10 copay for generic. If you can get it less, make sure you pay less, $30 for preferred brand name drugs, and then $50 for non-preferred brand name drugs. So remember, consult with the carrier when it comes to this specific prescription drug coverage, what drug falls under what tier, and make sure you read up on your actual summary benefits of coverage when they send that to you. Rates. So here are the new rates. So you can see from premium to enhanced on how these rates look for each plan. All right, so on to the dental benefits. They are not changing. It's remaining with MetLife. And you have the PPO plan and the HMO plan. The big difference between the two of these plans is that the PPO is going to act and feel like what you're accustomed to with dental insurance. The HMO is going to be very restricted in network. So the PPO plan is going to give you 100% coverage for preventative services. After a one-time deductible for either basic or major, you're going to get 80% coverage for basic services and 50% coverage for major services with $1,500 in annual benefit maximum. There's a 3 times maximum deductible for family. Now, when you get over to the HMO plan, it does not really work the same way. Remember, it's a restricted network. These are the allowances in which you are going to receive in regards to services. This is what exactly they could cost for you. So make sure who you're going to is going to give you the best bang for your buck. All right. As you can tell, the difference between the two, the PPO and the HMO, has to do with the difference of benefits and difference of network. All right, on to the vision benefits. So the exam, first of all, it is staying with VSP, and then it's really simple. You get exams covered in full after a $10 copay every 12 months, and then your materials, your prescription lenses are covered in full after a $25 copay every 12 months. So that's like single vision lenses, bifocals, trifocals, lenticular. If you get the line removed, there will be extra cost for it. Frames, you can get up to $130 allowance after a $25 copay. You get a 20% discount on the remaining balance every 12 months. And then your contacts, they will be covered in full if they're medically necessary, or you get a $130 allowance for them being elective. You can't get contacts and prescription lenses. You got to get one or the other, and there is a $25 copay with that. Please pay attention to the lens options and the LASIK services and discounts that come with it. This is your cost for 2015-2016 for the vision plan. All right, so your company paid benefits, they provide you life insurance and long-term disability insurance. You do not need to complete any open enrollment materials for these benefits. Basic life insurance, Target Engineering provides all full-time employees with basic life insurance that equals 1 times your annual base salary. Contact HR to update your beneficiary information. That's always good to know. And then long-term disability, Target Engineering Group provides all full-time employees with long-term disability coverage. It starts on after the 90th day. It's covering your income at 60% up to $6,000. Now, if you want more insurance outside of what they provide you, they do offer you a voluntary group term life insurance. You can get it in benefit increments of $10,000 accordingly for yourself and your spouse. Minimum coverage is $10,000 up to a maximum of $500. You can't exceed 5 times your annual salary. This is a term life plan. You do have to go to medical questions you got to go through medical questions in order to get it if you do not currently have it and if you're not currently new. So there is an evidence of insurability that is required. Children can be covered as well, but you can see how the rates work, and these are per $1,000, and there's a great example right there for someone who is 50 years, someone who is 37 that wants $50,000 in coverage. It would cost $2.45 per pay, respectively. Please refer to your benefit summaries for more information. All right, so now on to the voluntary short-term disability plan. This is strictly voluntary, strictly up to you. This is just income protection to cover the gap before long-term disability kicks in. So you can protect your income up to 60%, not to exceed $1,000 per week. The benefit starts after the 14th day you've been out of work due to an accident or an illness, and it will pay up to 13 weeks or until your long-term disability kicks in. There is a pre-existing condition clause, meaning that they're going to look back 6 months from the effective date and exclude any condition that you've been treated by a member of the medical profession for, or have even taken prescription drugs for the first 12 months of the policy. So please keep that in mind. This is an income-based program, so you'll want to call in the call center and actually get that rate if you're truly interested in it. Short-term disability is just income protection in the event you were to be hurt off the job or an illness such as maternity, surgery, etc. were to ever occur. That way your income is covered while you're at work. Now, on to the financial gap plans. This is the accident plan. The next one I'll go through is the critical illness plan. Accident insurance covers you on and off the job. It's just there to fill the gaps in which your medical plan doesn't cover, like the deductibles, the copay, and the coinsurance. So it is going to cover everything that your medical plan does, just on a smaller scale. It's going to give you coverage for accident emergency treatment, follow-up physician visits, physical therapy, hospitalization visits to cover you for the accident itself. Transportation and lodging is even included. It is a great plan for those who might be endurance athletes, those who might be very active outside of work, those who have children that are starting to drive or playing sports, those who might drive a lot themselves or in a very high-risk industry, and those who might have a spouse who's in a high-risk industry. You can see there for the select plan what the cost is from employee only to family coverage. Again, it is on and off the job coverage 24/7 there just to provide you financial gap exposure assistance when it comes to your medical plan. The money pays directly to you. Under the critical illness plan, there are no plan changes with this one. It's still through USAble Life as well as the accident plan. It's just a living life insurance plan. You can choose $5,000 to $100,000. You can cover yourself for heart attack, stroke, end-stage renal disease. Basically, what happens if you have one of those illnesses, it triggers and pays you just that lump sum payment. It does have a bypass surgery benefit of 25% of the face amount. So if you chose $10,000, it would pay $2,500 to you. And same thing goes for the balloon angioplasty, stent, or laser relief surgery procedures. You do get a $75 annual health screening with this benefit as well. So call the call center if you want rates on this plan because it is based upon your age and you can pick and choose your different levels of benefit. And then the hospital indemnity plan is like a mini medical plan. It's just going to cover those specific 4 bullet points. You got 2 choices. You got plan 1 and plan 2. Plan 2 is only going to be the one that covers the outpatient indemnity benefits, such as a doctor's visit. Both plans are going to cover inpatient hospital indemnity benefits, surgical and anesthesia benefits, accident and injury benefits. This is a gap plan, and there's no changes to it, but it is specifically there to be bolted on to your medical plan. But once this is being sent out and once you see everything, there is additional details on how this plan works within the benefits summary. So the healthcare flexible spending account, we are not actually going to enroll in that right now. That will be occurring in December for a January 2016 effective date. So stay tuned for further details to that. All right, so what do we do from here? Enrollment will be completed in 2 facets this year. Medical, dental, and vision plans will require enrollment forms that HR is distributing. All employees must complete this form, whether enrolling or waiving in coverage, and they are due by September 25th. Now, if you're interested in enrolling, terminating, or learning more about the voluntary life, short-term disability, accident, critical illness, or hospital indemnity, call 1-800-618-8575 between 8 o'clock and 5 o'clock Central Standard Time. So that's 1-800-618-8575.